Welcome to a special month-long series of recoverHER, where we dive deep into the transformative world of psychedelics and their potential for healing mental health. In this series, we'll explore how substances like psilocybin, MDMA, ayahuasca, and ketamine are reshaping the landscape of mental health care. From anxiety and depression to PTSD and addiction, we'll uncover the groundbreaking science behind these therapies, the role of spirituality in healing, and the practical tools for integrating these experiences into everyday life. Join us as we journey through expert insights, personal stories, and the profound potential psychedelics hold for mind, body, and spirit healing.
Welcome back to recoverHER podcast. On today's episode of recoverHER podcast, we're excited to welcome Dr. Quinn Snyder, Chief Medical Officer at Kadelyx Health. Dr. Snyder is a seasoned emergency physician with over a decade of experience in using ketamine as an anesthetic in the emergency department. His journey into therapeutic ketamine treatments was sparked by his discovery of its potential for treating conditions like depression, PTSD, and anxiety. Under his leadership, Kadelyx Health has developed a unique approach to guided ketamine therapies, combining cutting-edge research with ancient wisdom to provide transformative healing experiences for clients. Dr. Snyder's passion for integrating ketamine into mental health treatments, along with his deep understanding of set and setting, has led to life-changing outcomes for many. We're eager to hear his insights on the future of mental health care and how psychedelic therapies are reshaping the landscape of healing. Let's dive in. Welcome.
Hey, thanks so much for having me.
So
Appreciate
glad
it.
you're
Glad
with
to
us.
be here.
Yeah, glad to be here.
So tell us all things Kadelyx Health. I think it's something that Phoenix has needed for a really long time, and I think you are the secret sauce
Yes,
and
you are.
what's been missing from this landscape.
Well, I hope so, yeah. I mean, Kadelyx, I'm really proud of what we're doing. I really feel like we've decoded the experience from start to finish of what is needed to really provide a sincere therapeutic experience using ketamine. And I think a lot of people have overlooked a lot of those elements, you know. Starts out with preparation, then medicine, then integration broadly, you know. But there's a lot that goes into each of those phases. And we have guides rather than therapists at our clinic. So the guides are really, truly expert at kind of helping people navigate all those portions of the encounter. We also have medical staff on site at all times. We are very prepared to deal with any medical complications whatsoever that may arise from ketamine. And yeah, I mean, ketamine it's a safe drug when you use it in a controlled, monitored setting with medical professionals. You know, and yeah, I think there's been a lot of cases, obviously, of people not using it in that way, and it's unfortunate. And you know, I think for the most part, though, I think if you do it safely, if you do it in this really kind of robust experience where you really acknowledge all the elements needed to provide that sense of safety that people really crave, I really feel like safety is a prerequisite for healing.
Yeah,
Absolutely.
I love that word.
When people feel that, they can really allow themselves to open up,
You're right.
you know, and explore those like deep-seated things that we all have inside us. But I think for a lot of people with depression, anxiety, and trauma, there's these things that really lie deep within that they can't even access.
Absolutely.
You know? So yeah, and I think ketamine is just an incredible vehicle for that.
Yeah, I think that's really well said. And one of the things that's, I think, so unique to Kadelyx is the space. So I know for myself, just, you know, if you're going to approach Western medical care, the environment is not conducive to healing, right? It doesn't matter if you're walking into the dermatologist's office or a surgeon's office or the dentist, right? There's a certain amount of
Well, it feels cold and
sterility.
clinical, right?
Yeah.
How is Kadelyx different?
It's totally different. And like, I'm really glad you said, you know, whenever I talk about Kadelyx with people, like the setting is like this. It's like this character. It's like this this additional therapist as part of the experience, you know, that's present throughout the encounter. And I think that, you know, look, I'm actually entering my 15th year of clinical practice now in the emergency department, and I realized stepping out of that now and stepping into Kadelyx that The emergency department, it's like it is designed, and the hospital in general is really designed for the sake of the practitioners.
Yes.
It is not designed for the wellness of the patients. And it's like, yes, wellness, health, the treatment of disease does occur, obviously, in the context of the hospital. People do improve, but there are so many elements that are overlooked in that entire experience that could probably actually, if hospitals realize that, they could probably move people through even faster, with throughput and everything, and get them home in a better state than they were previously. But they don't really look at that because there's just elements that you need to do that, there's so much chrome and vinyl and plastic in hospitals because it's easy to wipe down, and you got to move people around. There's just all these elements like that are really designed for the sake of the functioning of the hospital. And that's
it so sterile.
Very much. Yeah. No, and Kadelyx has this really incredible warmth. And one of the things I always tell people about Kadelyx is that, like, what I love about it is that if I had designed it, it wouldn't look anything like this.
I've heard you say that before.
The clinic is so beautiful. It's warm, it's cozy, it's comfortable. Most of our clients, have ketamine sessions in beds, which is a totally different kind of experience than showing up in like something that feels like a dentist's office and you just kind of unfurl your arm and get an infusion and then you wave goodbye. That's just not how we do things. Like, we really try to create like the fulminant journey, the experience, and really try to cultivate that on behalf of our clients. Yeah.
I think what you said is so accurate, and I hadn't thought about it like that. It really is like a living part of the treatment experience. It is like having another therapist or a guide present. It's so important. And I've been in lots of different clinical settings related to ketamine, and it's very unique. It's very special.
Yeah, I think people really crave that warmth. It's just like it's just missing in so many clinical settings. And yeah, I mean, I think we've got that part figured out. And I don't know. And I'm seeing this kind of repeatedly in like as the evolution of psychedelic medicines starts to unfold here over time. Sometimes I've seen these clinics in Oregon maybe, and people are doing these medicines in this like ultra sterile looking facility, and I'm just thinking to myself, wow, that is just not really going to bring out the best in that person.
It's not very conducive to optimal healing, I don't think. And I've been to Kadelyx, and you just walk into that space and my nervous system immediately just drops right in. I feel, the opposite of fight or flight. I just feel held and safe, that word that you brought up. And knowing that you experience that within your environment is kind of the first step, because there might be people showing up who have heard a little bit about the benefits of ketamine, and maybe want to try a different model besides talk therapy. So as medical doctors who both have been trained in ketamine-assisted therapy, tell me a little bit more about that and the benefits behind what ketamine does, not only to the brain, but taking us offline as far as disassociate, and why that's beneficial.
Yeah, no, so you just mentioned something really important, by the way, is that I think first and foremost, people heal in different ways.
Yep.
And like our healthcare system in general is somewhat hostile to that. Like, they want you to go through this protocol and go down these pathways that they're going to tell you to do. But the reality is sometimes like those pathways aren't what's best for people. For instance, like I look at depression as a time-sensitive disease. I don't see why people should have to wait months on end in their depression. So a disease that carries a significant mortality rate, by the way.
Right.
Like, why do we,
have prolonged suffering inside of that space.
Yeah. There's no reason just to be miserable for that long.
The cost is, number one, the cost can be your life, but the cost in totality is huge, to your physical health, to your relationship health. And so that's where traditional mental health care has struggled in one way, is it takes a long time
to heal,
to feel better, whether it's with psychotherapy or with traditional psychiatric medication.
Yeah. I mean, I think that, the data with like SSRIs, it seems like in all likelihood, the first SSRI that you're going to take is not going to work, which is just astonishing to me.
Right.
I mean, like,
what is the percentage? Something like 40%
It's like about
likelihood?
40% is
Right.
what
So
most people
I
think.
would take
Yeah.
a pill.
I trained you well.
I know. Thank you.
Welcome.
Yeah, I listen.
Yeah, I mean, it's 40% of people are going to get better with it. And then not to mention, I mean, there's obviously those positive effects, but there's a lot of negative effects too, right? I mean, like weight gain, sexual dysfunction. I mean, these are really important things. A lot of, and frequently we get people coming to Kadelyx who are specifically trying to get off of their antidepressants. And many of them, it's because of those side effects. Those alone are problematic enough for, I mean, there's, 13% of Americans are on SSRIs, by the way. I mean, it's...
Did you say 13?
13, yeah. 13% of Americans are on SSRIs, which is kind of an astonishing statistic when you think about how many people are on these medicines. But
That are not very effective.
I mean, they work for some people, right?
They work for some people.
Yeah, they do. They work for a lot of people, and a lot of people are comfortable with it. The side effects are manageable for them.
Okay.
And I'm all for that. I'm
Yeah,
all
if
for
you need
that.
it and it works for you, of course, that's an option.
And obviously a lot of people, psychotherapy works great for them,
Of course.
And then for some people, ketamine is the way to go, and medications with psychedelic properties, like that is what's going to help them get through their trauma, their depression, their anxiety, and that's really going to enable their healing. And by the way, you can do all three of those.
That's
if
right.
You want.
Right.
There's no reason why you can't do all three. I feel like anything that will enable your healing is
You should do.
It's go
I'm
time.
open to
Yep.
it.
I agree.
Why should we be hostile to any of that?
Yeah.
So yeah, I'm all for it, but I do think that like ketamine is a cornerstone part of
Yes.
of potential healing for so many
So
people.
many people.
And it's really like it's the wave of the future. Ketamine and other psychedelic medicines, including psilocybin, MDMA. I think we're just at the beginning of this.
Sure.
But ketamine is legal. It's very well understood at this point. I've been using it for 14 years in clinical practice, and now starting my 15th year, but in all kind of settings at this point, and everywhere from the emergency department, putting hips and shoulders back in, intubating people, and now using it for psychotherapeutic purposes. I've used it for pain as well. I mean, it's an incredibly complex medicine, in terms of just the general science of it. It's an NMDA antagonist. It modulates glutamate throughout the brain. One of the exciting things that it does is it modulates a brain-derived neurotrophic factor, which results in increased neurogenesis and neuroplasticity, which is really, I think, probably kind of the crux of what is so important about ketamine, because it allows the brain to develop new neural pathways.
Right.
And those new neural pathways are literally pathways that allow you to see the world in a different way.
See yourself in a different way, see
yeah.
yourself in the world in a different way. And I also, I feel so energized every time you and I talk, because we are very similarly aligned, right? We're not bringing ego into the game here. We're really talking about wanting to offer a particular model with ketamine that can help people heal. And we are open to, you're so open to wanting to work with other practitioners. You're not possessive of this healing modality. And there's all different kinds of ways to use ketamine. You just happen to have landed on a way that aligns with your clinical expertise as well as your heart, and to be able to deliver it in a model that we know has proven results. And I think it's
effective.
Sometimes we'll laugh because people are really weird. Professionals sometimes get really weird when it comes to healing, where they say, this is the way and this is the only way. And all that does is it limits the amount of people that can access healing, and it causes polarization versus, hey, like, what can I bring to the field? What are my gifts that I can bring to the field and offer it in my unique way? And I think that's what you've done so beautifully with Kadelyx. And I think, you mentioned some of the really important things in the way the ketamine works is it's offering a different kind of neurotransmitter cocktail than the traditional serotonin module, with the neuroplasticity and working on glutamate and the BDNF, and it also has some really wonderful anti-inflammatory properties that I think as we have deeper understanding of the brain, we're going to understand why that's so important. What do you think in terms of so for people listening that are saying, I have no idea what you three are talking about right now, because we've gotten that feedback that when we get excited about a particular modality, people are feeling like, I just want to feel better. And I know I've been told I have depression. What is this ketamine model? And specifically, how would I access it? What would you say?
Yeah. So, I mean, ketamine can, there's numerous ways that people are administering ketamine out there. There's a lot of different ways. And back to what you said about like just finding like who I am and like what my skill sets are, like my sense is that my place in this space is related to the fact that I'm here to keep people safe. I'm here to provide this in a safe setting. And I love that. And, you know, like the way we do it at the clinic too, is with the guides and whatnot. The guides are the really ones, like I've always felt like I'm there to create a platform for their healing. Like the guides are the ones who are really doing the heavy lifting by really holding space, being with our clients at bedside, really making sure that they feel safe and comfortable. You know, I'm just there kind of in the background, really just to make sure that medically they're safe. But, you know, how do people access ketamine? You know, you can, frankly, at our clinic, if you have a history of depression, anxiety, PTSD, if you are interested in receiving ketamine for those indications, then yes, you're welcome to come to our clinic. You can just self-refer. You can go right to the website, Kadelyx.com. You can start filling out forms, and usually we can get people in within a week or two if they need help. You know, even sooner sometimes. We do work with local therapists and we work with local psychiatrists, because the goal of what we do is to augment their care. We're not in a position where we're trying to say like, okay, like we're the end path to the healing. Like we recognize, and the studies bear this out, that generally that ketamine adjacent to psychotherapy seems to be the best outcomes.
Right. That's some good integration right there.
Oh, you got it. Exactly. Yeah. That's where the ongoing integration happens. And, you know, but for our clients, you know, like we're not, if you don't have a therapist, if you don't want to have a therapist, you can still come and get ketamine. If
and your experience can be facilitated through your guide's help.
Yeah.
With talking before and after the journey, journaling throughout, and then having somebody right there for me to be able to kind of ascertain everything that happened in my mind and talk to you about it, and then I can kind of unravel it as well.
Yeah, no, definitely, and that's how we like to do it. So, like in that early integration phase, right when you come out of the ketamine experience, the guides act as scribes. They really just try and help download that information from you, and you're just, you know, let you talk. Like, what were you experiencing? Where did you go? What were you feeling? What were you thinking about? Just, you know, really nuts and bolts details about just the experience itself. The time when you first come out of ketamine, and this is, you know, regardless of if you end up doing ketamine with a psychologist, a psychiatrist, a ER doctor, a guide, whoever, whatever, when you first come out of the ketamine experience, that's not the time for therapy. Right. That's not the time. Your brain is still rewiring and trying to figure itself out. The real time for therapy, and that this most people in the field agree, that's usually about 1 to 7 days afterwards. Right. That's when you should try to connect with your therapist to kind of help address what happened. But yes, we write down those thoughts for you in a journal, and then we package it up and we give it to people to take home with them, and for you know, to either digest on their own, or to share with their therapist. But we also the guides are very good about making recommendations to our clients in terms of ongoing integration, what things they can be doing at home, including journaling, and a variety of other modalities that potentially can help with their ongoing healing. Yeah.
So you kind of talked about, well, first of all, how long does a typical journey last at Kadelyx?
So we set aside about 3 hours typically for a full journey. Now,
by the time I walk in your door,
right.
Okay.
In the door and until when you leave 3 hours.
3 hours.
But typically people are under the influence of the medication about 60 minutes or so, usually
Okay.
anywhere between about 45 to 90 minutes. You'll feel the effects of the medication, but leading up to that, we do the preparation and then of course the integration afterwards. And then we do administer it in a few different ways. Some people, we also do what we call semi-guided sessions. Anybody who comes into our clinic, we just don't feel comfortable with this model of like, here's your medicine, see you later. That's just not what we do.
Right. Nope.
So when you come in, with the semi-guided experience, we do have kind of like a shorter preparation period. And a shorter integration period, but the guide is not with you at bedside during the medication. We do continue to monitor people using a continuous heart rate and pulse ox monitoring just from outside the room, but we don't have somebody with you at bedside. And that's just, and we do IV, we do IM, intramuscular, by the way, which most people in the industry feel is a superior way to do ketamine, and that's for a variety of reasons. Intramuscular, where they do direct injections of the arm, basically people feel that one, the contour of the experience is better. It tends to ramp up a little bit more quickly at the beginning, and then there's like a slower taper off as you kind of re-enter your body, because ketamine is a dissociative anesthetic, which means you're having this almost like out of body experience. It's a dissociation, and oftentimes we say that people, you step outside of your body and then you come back in, and sometimes things look a little bit better than they did before. Just having that experience of stepping outside yourself, which is something that we really can't do in our day-to-day lives.
Right.
It's just not something most people have the time or the space to do.
Yeah.
So yeah, I mean, I think when that does occur though, that can be very therapeutic. So yeah, but the whole experience usually is about 3 hours for the fully guided sessions. 2.5 maybe max for the semi-guided sessions.
Right. And I suppose there's different various degrees of not only dosing, but then how much a client or a patient metabolizes that medicine that dictates how long you're in a journey.
Yeah, it's pretty. Yeah, I mean, it is. It's different for different people. It seems, the cool thing about injectable ketamine is that you can really dial it in, either IV or IM. Like, it's very predictable. The intranasal stuff, the oral stuff, when you look at the bioavailability, which means like the amount that your body actually like absorbs and experiences, let's say, the bioavailability of the oral and intranasal version, like the span is like
That's
15
trickier.
to 25%. I mean, it's massive. So like you just don't know when you get it. Am I going to get the lower end of the experience or the higher end of the experience? You just don't know. There's just so many factors why, but like with either intramuscular or IV, you know exactly how much they're going to get. It's weight-based dosing, but yeah, some people do seem to metabolize differently for whatever reason. It's true. Some people, take a little bit longer, and some people are out really quick, surprisingly. And then, yeah, like anything, like ketamine is not a perfect medication. I mean, it's not everybody is going to have this dissociative experience. Even some people will have no experience whatsoever. Some people will not have a therapeutic experience. It seems to be a relatively small number, frankly. But, it's just important to know that, there's nothing after having practiced medicine for as long as I have, and I'm sure you feel the same way. It's just like, there's just no magic bullet to all these things. Like you just, things are different for different people.
And I want to be clear, it's that you're typically, the recommendation is never to come in for one experience. So what we've found is a series, starting with 6, and we, on average, we're shooting for a week apart. You can tailor it to someone's specific needs, and then based on monitoring their outcomes, you can figure out if they're going to need fewer sessions, if they're going to need more sessions, when they might have to come back in. So sometimes when people hear us talk, because we get so excited about these non-ordinary states of consciousness that people think it's like a one and done thing, and that's not it. But the way that I like to describe it to people is that with trauma, with anxiety, with depression, your worldview and the view of yourself and your world in general gets really, really small. So it's kind of like this window shade. I like to think about like the old-fashioned window shade that you pull down, and it's down, right? Your mind's default mode network, which is that thought looping, is just on repeat, thinking the same thoughts over and over again, seeing yourself the same way, seeing the world the same way. And so you're taking advantage of ketamine, the molecule, which, Dr. Quinn commented on how that works in the brain. And then you're also getting this break from the thought looping. So your default mode network is really quiet. And so in this experience, the window shade is gradually opening up, and there can be this expansion. And there's also this opportunity, depending on dosing, to have a full psychedelic experience where you're experiencing, some really funky things that you get to explore and see how that connects to your consciousness. And then you have this beautiful setting of Kadelyx, which you describe as a warm hug, where I think there's something. Listen, we don't take care of each other in this world. We don't. We don't take care of each other the way we deserve to be taken care of. And there's something very healing coming into an environment that is safe, having an environment where you walk into this room and everything is just set up
in.
Just so. And then you are also being served, right? The guides are serving you. They're taking care of you. They're offering you, essential oils. They're helping you dial in the playlist. They're offering you, while you're processing afterwards, for the love of God, like fresh fruit and chocolate and some tea. So just the fact that while you're doing this hard work of healing, and there's someone there
You're being held,
taking care
literally
of you, that in and of itself is very healing. So I think all of these things is, it's a beautiful mix. And then you have this opportunity where your window shades up, and then you have the obligation as the human trying to heal to start making changes, because it's this window of opportunity, I like to call it, because
when the neuroplasticity is raw.
That's it. Yep. And you get to start interacting differently. You get to start practicing different healing. You're open to seeing maybe your wounds differently, and it's really.
So you can't just take the medication and your life is better.
By the way, that was really beautiful.
It really
I feel like that was like a poem you just created about Kadelyx. It was beautiful.
Definitely from a psychiatric perspective. That is the ideal scenario. And Kadelyx has done such a beautiful job at creating this soft, yummy place where you can just go offline for a moment to allow everything within to grow and change and flourish. Yeah. But you're right, the work then begins after the fact, which you mentioned earlier. It's that week after where you have this moment of not only just pause, but when it's just ripe to make some big changes or small changes within your life.
It's a big opportunity, and I think that is probably one of the fundamental differences between Western medicine and pretty much all other modalities of healing across the world. And I realized this. I remember when I was in India when I was 25. I went with a friend of mine, and we went studying, at that point, alternative forms of medicine. Basically,
Okay.
We learned about different things that were going on, like Ayurveda and homeopathy, and just different things that were happening over there. And I was really trying to kind of distill down what is really happening with these things. Why are people so attracted to these forms of medicine that frankly have less of a research base, less of an evidence base, and just yet have been practiced for thousands of years. Many of them, and people fully trust them. And my general thought, my general conclusion was that these other forms of medicine were much better at engaging the patient in their own healing. Western medicine does not do this. And the ultimate, I feel like emergency medicine is really the ultimate in Western medicine.
Yeah.
It's something acute is happening. I go to the ER, but the attitude is, this is happening to me, fix me.
Yes.
And and not like taking a lot of ownership a
Right,
lot of
personal
the time.
accountability.
Yeah.
Like maybe the 50 years of cigarettes that I've been smoking and like the terrible food I've been eating and all these things, like maybe that's plays a role in how I ended up here. It's like there's just not as much of that accountability. There's not as much of just engaging the patient in their own healing moving forward too. It's like we just patch people up and just wave goodbye. And it's just like there's so much more to it. Like and I think what you're describing with it's like this, your own integration really as it goes along. Like people, no one should expect to go into anything in medicine and just presume that this is a one-off and you're good. But especially this. Yeah, I mean, for really sustainable long-term healing, it's all about engaging in your own healing as well.
I kind of liken it to, so I grew up in Reformed Judaism, which I still practice and feel very connected to, so I'm not bagging on anything. But so I grew up, I did the Hebrew school and the Sunday school and bat mitzvah and going basically on high holidays and sometimes celebrating Shabbat. But the rest of the time I was just like off doing my thing. And it wasn't until my adult life where I really was craving more spiritual connection. And I remember going to talk to the rabbi about it because it felt very foreign to me because I could read Hebrew, but I didn't understand anything. And I was like, I don't know how to pray. Like I don't get, like I don't even understand the words that I'm saying. And he was such a great guy, but politely said, like, he's like, so what is your expectation? Is your expectation you're going to walk into synagogue, you're going to sit down while you have me like on what they call the bima or like, the head of the stage, and you're going to listen to me, and then you're going to go and you're going to feel spiritually connected, and it's like, no. And it's the same thing in healthcare, I think, and we're not blaming anyone, but it's like once you have the awareness, once you have the understanding, once you have a team willing to surround you, then, let's all be in it together. And I think that togetherness is really important. And we know you have to heal in community, a safe community. And I think the dangers of mental health is it causes so much thought distortion sometimes, particularly suicidal thinking. And that's why I'm so grateful to ketamine as a medicine, because when you think about like an emergency in psychiatry, one of the emergencies, and I know you ER doctors always like to laugh at a psychiatrist in the emergency rooms. What's the occasion? Guys are mean sometimes, but
we're happy to have you.
I know you're just so shocked.
We love when psychiatrists show up, but
it's just not very often. But when a patient is experiencing a mental health crisis, and specifically related to ketamine, when you are experiencing suicidal thoughts, you can get help and with very rapid relief with ketamine. And it's like
that's amazing.
That's amazing.
Yeah.
That's a
That
distinguishing
can't be
factor of
ignored.
ketamine. I mean, the fact that the fast acting nature of it is just astonishing. And by the way, talking about ketamine in the emergency department is fascinating because all of us have been using it for so long for just this procedural element.
Yeah.
And then now that these like psychotherapeutic aspects have really become obvious, there's still a lot of I don't want to say hostility, but just like a lot of misunderstanding.
Very true.
And it's also reflective, I think, of the general public about ketamine, but especially in the emergency department, because I really think most people do not understand how valuable it is. And that indication in particular, by the way, is suicidality.
That's it.
Acute suicidality. And I envision a future where ketamine will be given routinely in the emergency department for people with acute suicidality. I think it's inevitable. I mean, the data at this point is pretty obvious. It's probably the most effective anti-suicidal medication that exists. I mean, it probably is. I mean, so I don't see how we couldn't be giving that. And, that's a lot of how I entered this space, is watching what's going on in our mental health apparatus in the acutely ill patients. I mean, in the pandemic, it was unbelievable. I mean, I watched adults, kids wait weeks. I mean, literally weeks.
Yep. Weeks.
In an emergency department.
That's too
waiting.
long.
It was horrible. It was terrible. I mean, these poor kids are waiting to find some sort of definitive psychiatric care, and they're just like, there's nowhere for them to go. There's just not enough resources. I mean, and with the adults, I think it's probably not fit to print for the kids yet, but still, like, teenagers, I do think ketamine absolutely has a space for
sure.
teenagers, and we have treated teenagers before, by the way, with tremendous success. And I think it's a very important population that should have access to ketamine. But in the ED, with the acutely suicidal patients, you look at the options, you're like, okay, here's somebody who's going to stay here for days or weeks on end without any treatment. Or maybe I could give them ketamine, have them go home, and potentially get some follow-up in an outpatient setting rather than some sort of inpatient setting, which is obviously a lot less costly, a lot easier for the patients. I mean, obviously we want to protect them, but we also need to make sure that, frankly, there's enough space in the emergency department a lot of the time. I mean, it's a lot of resources that we need to, make sure these people are safe in the ED, knowing full well that most of the time that this is not the best setting for them. Like, this is not where they should be. So I mean, I think it actually is. I think it's very, very high probability eventually it will be much more readily used in the emergency department for that indication. Yeah.
I'm also surprised in that the majority of inpatient behavioral health settings where, many patients are coming in with acute suicidality, but, that's one of the criteria to go to inpatient behavioral health, that ketamine is typically not offered in that setting, which is pretty mind-blowing when you think about that. I know I'm jumping around a little bit, but I also wanted to get your thoughts on the role that ketamine plays with end-of-life care.
Oh, yes. Ketamine is the drug for palliative end-of-life care. I am 100% convinced. I think it tell me another drug that can treat pain, deal with depression, anxiety, and help people navigate existential crises.
Oh my God.
I don't think there's anything else out there as far as I'm aware. I mean, these cornerstone medications in the hospice and palliative care world, like methadone and morphine and whatnot, great for pain, not much else. Ativan and whatnot, great for anxiety, doesn't really deal with pain, obviously, and the antidepressant. I mean, everything is in its own silo. Ketamine does all of it. I mean, and yes, we've had end-of-life patients, we've had palliative care patients who have had just unbelievable success with ketamine. And medicine is so cultural. Like, you end up doing the same thing over and over again.
Yep.
And it's just really hard to think outside of the box.
Yes.
Which has really been, honestly, for me, this whole thing has been thrilling. To get to enter
creative.
this, totally, this is tip of the spear, the total frontier in medicine, get to do it. And the outcomes are just unbelievable. I mean, it's so exciting to get to be a part of this kind of a thing and get to see people really, really heal. And just to take the mantle of something I think is extremely important and is the wave of the future. It's obvious this is all coming, But yes, the palliative care, end-of-life space, I'm very enthusiastic about ketamine. I think there's going to be a lot more to it.
You're answering so many of my questions in my head before I even get a chance to say them out loud, because I was going to ask you what the opposition is then, if it happens to be so effective for not only suicide prevention and end-of-life care, then why wouldn't? What is the opposition?
Here's the tricky part. So when you look at FDA approval, the only form of ketamine which is FDA approved is called Spravato, and it's an intranasal preparation, and it's very tightly regulated in how you prescribe it, what doses you prescribe. But ketamine's been around forever, and it has to do, I believe it has to do with control and then cost. So the ketamine that we're talking about is all considered off-label use. And so that impacts hospitals' ability or willingness to kind of take it on, and it impacts reimbursement by payers. So that puts up some barriers.
And by the way, not abnormal to prescribe things off-label. A fifth of all medications that are prescribed are off-label. Especially in the psychiatric world, there's a ton of stuff that's happening off-label. But it's still like what happens is a lot of the time with that lack of FDA approval specific to that indication, meaning depression, anxiety, or whatnot, the insurance companies typically don't reimburse, unfortunately. S-ketamine or Spravato, that's an anti-emeric ketamine, right? So it's like just one kind of half of ketamine, really. The outcomes across the board are not nearly as good as racemic ketamine, the injectable stuff, but it does seem to help people. Absolutely, S-ketamine does.
No question.
Does help. Does not seem to produce the non-ordinary state of consciousness that the injectable ketamine does. The way we do it, the way a lot of people are doing it. But there's a lot of reasons why S-ketamine, in my opinion, is not as good. But part of it is just because of the way it's regulated, the way insurance companies reimburse for it. They will only reimburse for it if you have typically tried two antidepressants over a 6-month period prior to even considering whether this qualifies for your use as S-ketamine. And like I said, I look at depression like a time-sensitive disease. I just don't see. And there's so many reasons why. Like, I just don't think people should have to suffer. And I think most people with ketamine clinics, agree with that. But in terms of the hostility, or in terms of or the misconception, I mean, as a combination of stuff, right? I mean, it's like it has baggage as a club drug, right? It used to be a club drug. There's been a significant increase. There's drug seizures of illegal ketamine basically went up between 2017 and 2022, went up 349%, I believe. I mean, it's starting to get out there again.
Yes.
And previously in the 90s, it was reasonably well controlled, but it was starting to become more of a club drug, and that's when the DEA scheduled it as a Schedule III drug. But now, and I don't want to point fingers, but I think generally we know where a lot of this diverted ketamine is coming from. It's not coming from clinics like ours that do injectable ketamine in there, but there are places that in all likelihood these drugs are coming from. And I think, frankly, I think that the industry probably deserves more regulation, especially with the stuff that is being prescribed to people who've never done it in a medical setting, in a supervised and monitored setting, which, by the way, the American Association of Ketamine, the ASKP3, I can't remember, it's practitioners, physicians, and psychiatric. I can't remember what the organization. We're actually a member of this organization, but yeah, they recommend that people do ketamine in a monitored setting, even if you're going to experiment with some sort of oral ketamine as an outpatient. That you need to do it in a monitored setting in person before you go out and do it in home, which just is not our general philosophy. We just feel like we provide a more robust therapeutic experience by doing it in person, just recognizing that we're people, we're humans, and that humanity is an important part of the healing equation. And people just continue to act like it's not a big deal, and it drives me crazy.
Right.
It's like, when are we gonna finally admit to ourselves that we need each other?
Right.
And also learn from past mistakes.
That's what I was going to say, from previous
so I think
generations.
I think if you look at the opiate epidemic, it makes sense why there's fear around the ketamine, because you can develop addiction to ketamine, not in the way that it's clinically prescribed. So Dr. Quinn and I are 100% confident that if you're using it for a clinical reason in a clinical setting with appropriate monitoring, you're going to do just fine. And we also, of course, screen for active addiction. And I'm also really excited about the role of ketamine, specifically for alcohol use disorder. The literature looks really good, but I think sometimes when medications aren't treated with respect, with reverence, without understanding, that's
a good point.
That's where things can
Get off
right
course.
And of course, we're seeing that with Matthew Perry's death, and how many? There was 2 physicians arrested related to that.
There were 2 physicians arrested in that, and like when honestly, what they did, it just it upsets me to the core in just so many ways.
Just took advantage of an addict is what they did.
They absolutely took advantage of like the most high profile addicted person in the world.
Sad.
And they took advantage of this guy. And, you know, when you look at what they did, I mean, they were really acting as drug dealers. They really weren't acting as doctors
100%.
or anything.
No.
They were just literally selling him vials of ketamine. So, like, it's just important to separate that. Like,
Very different than what we're talking about. Not even in the same realm.
No, it was like, it's so far flung from where we're at, where we do it in this like controlled series of treatments. You know, it's like, you know, yeah, we typically do 6 treatments in office and whatnot. That is just, I mean, he was getting, you know, and not on the same day, by the way. Typically, you know, anywhere from like a couple times a week to once a week. I mean, he was on the day he died. Reportedly, I mean, he had multiple injections from somebody who was non-medical, like in home, and he died. He drowned. Yeah. I mean, the guy drowned at anesthetic level doses unmonitored. Yeah. So, I mean, yes, obviously ketamine can have serious consequences if it's not used in a safe and controlled setting. But yeah, I mean, what those doctors did, like, just pissing me off. Yeah. It's just, I mean,
it's
granted, like,
heartbreaking.
Allegedly, I don't think it's all been fleshed out yet, but still, I mean, it's a pretty bad look. And in terms of like, what it does to the industry as a whole and what it does to like people's access to ketamine. Yeah, I fear that people are going to screw this up.
Yep.
I fear that there's a lot of practitioners out there who I think are using it in dangerous, inappropriate ways. Not going to lie. I think there are people out there that are doing things that I think are not helpful to patients. And, you know, it's obvious to me, like, this is one of the most important medications in the world. Like, and it's been on the WHO's essential medications list since 1985. I mean, it's not, I mean, we've all known this, but that's as an anesthetic. The fact that it does so many things, including have these like significant psychotherapeutic properties, like ketamine saves lives.
Yeah. It's an amazing
Ketamine saves lives. And like, if it goes away, if we get it taken away from us and our patients, I mean, people will die, plain and simple. But you know, ketamine's also kind of the, you know, the canary in the coal mine, I guess, for just the entire field of psychedelic medicines. Like, you know, what happens to ketamine is going to really dictate what happens to a lot of these other medications moving forward.
Like MDMA and psilocybin.
We have an opportunity here with our second go with psychedelics to
not fuck it up.
Yeah, so
that would be ideal.
We want to hold them, you know, and with high reverence. I'm curious. So, ER doc, you know, I haven't spent hours and hours and hours in that setting, but I am familiar with the setting. I know what it does to my nervous system when I'm there. Is your experience as an ER doc connected up to your commitment to healing and mental health? Like, I want to know what's behind this journey for you, because it feels personal.
It does.
Yeah, it is. I think there's kind of a couple threads there personally. I mean, I think a lot of it starts probably about a decade ago, where my cousin took his life. And he and I were very close. He was in medical school. He was 28 at the time. You know, I was his mentor, friend, and family member. We grew up together, very, very close. That was really hard, you know, for everybody, obviously.
What's his name?
Daniel. Yeah, Daniel Snyder. I miss him terribly. He was in a position where it felt like inevitable, though. Like, when I watched him in these last 6 months, especially in his life, like, it just kept going, and it just felt like he was being kind of dragged this direction. Like, and knowing what I know now, I probably would have thrown him in the backseat of my car and driven him down from San Francisco and gotten him ketamine. And at that point, it still wasn't really well understood. But he really needed to be medicated. And some people do. So, yeah, I mean, I think that...
was he engaged in traditional mental health?
So yes, he was. And including he was in and out of ERs actually for a while. Like he was having acute thoughts of suicidality and had been in a couple of ERs, and he was also in some inpatient treatment facilities. Had gone through extensive therapy and tried medication. I mean, he had tried everything. But it felt very much at the end like it was just like he was just being pulled down a drain, and like it felt like biochemical. It felt like just inevitable, and like, oh, I just wish it could have been different. Yeah. So I mean, I really dedicate a lot of my practice to him. And then really, and of course the other event really that kind of sent me down this road was the pandemic.
COVID, yeah.
And that's more of my general experience about the ER as an ER doc, you know. And I think we all had our own trauma in the pandemic. You know, I think everybody experienced a lot of different things.
I'm sure that left you with quite a bit of PTSD, though. How could it not?
Yeah. I think I was in a very unusual position. I mean, I was overseeing the clinical operations of the largest ED in the state. And not having enough staff to staff, you know, an ICU as well. So I was working in the ICU, and working in the ER, and, you know.
And a triage in the parking lot.
Yeah, stuff like that happened. Yeah. I was responsible for kind of setting up tents actually in the parking lot to screen people at one point. Yeah, that was one of the things I worked on. It was. What
was it, you know, kind of when you think back on that time, like, if you were to replay it in your head, like a movie, like what did you start to notice changing about you and how you were feeling?
It didn't happen immediately. It happened later. It felt like initially I felt like this odd feeling, like this was just this moment in my life that I had to like give my entire body and everything who I was to this moment. It just felt like I was built for that moment. Like it really felt like I was supposed to be there at that time doing what I was doing.
Because you were.
Yeah, maybe. Yeah.
I think so.
I mean, I felt like it was just something I had, you know. So yeah, I just opened myself up, and probably too much in some ways. But like but at the same time it was like, you know, we had an incredible group of other docs there, you know, and nurses, and like everybody who works in that hospital, like just absolutely incredible people. The healthcare workers are just phenomenal people. And I was really proud to get to go through that with them. But I think I think when things started to turn was when it became just like, it was so frustrating to feel like we were not being backed by our community. And like to go down the street to work, and you're literally going to watch people die at work, and on the way to there, you see people drunk hanging out of bars, you know, on the way, and you're going in for a night shift or something, and people are just like out in the street, and you're just like, oh my God, is this really happening? Like, I can't control that. And I thought, I mean, I didn't really ever think I could control that, but I also felt like I had this responsibility to do whatever I could on behalf of my community. And so, you know, I was doing like interviews and stuff on TV, like national news, international news, like just bizarre stuff. Like, and it was almost like having like an out-of-body experience, frankly, because it just felt like I was, I had to step out of myself in some ways to like, to be able to cope with.
To be able to do it.
Yeah. I mean, but like, I mean, you know, and I was thinking about it on the way over here because I had a feeling you probably want to talk about this a little bit, but like some of those moments, I think some of the hardest moments are when patients were either struggling or about to stop breathing, and I'm intubating them and thinking to myself, I'm probably going to be the last person this person ever sees. You know, because typically people were dying, about 75+% of people. If you got intubated, like you were probably going to die. And that was pretty hard, to absorb all that. So over time, I think like coming out of the pandemic and starting to decide that it was time to focus on me again and my relationships and my family, who had backed me 100%, by the way. My wife is like this totally incredible person. She was like, she had my back and was supportive of everything I did and made this like very safe environment for me to come home to every day. And I could not be more grateful to her and my kids too.
How old were your kids at that time?
Oh, they were young. Yeah. I mean, born in 2015 and 2017.
Okay.
Yeah. At one point I started, I was starting to write about what had happened. And the first thing I did is I just look at some old photos of like what had happened in the pandemic. And I saw a picture of my son. It was really hard, just I loved him so much. And he just really stood up for himself and his community and his family, got his vaccines and everything. That was the shot I saw, was him with a Band-Aid on his arm. I was like, I'm so proud of him, weathered that challenge. Anyway, it was pretty obvious coming out of the pandemic that I need to be medicated too, and I don't think anybody should ever, feel ashamed that they need that. And I'm really glad that I get to provide that to people now.
Yes.
Well, you're an amazing man and MD because of your experiences, for sure.
Thank you.
So I'm grateful that you can feel the full range of human emotion and just share everything that you went through. I really am very grateful for that. So your healing helps me heal. So thank you.
Thank you.
And I think taking all of that and using that same energy that you used to save lives during the pandemic and the leadership that was required and just I'm exactly where I'm supposed to be. I was built for this. I can do this. And then recognizing your own limitations and own suffering and your own need for healing and taking care of that and then being able to shift that energy into what you've created at Kadelyx. I don't think enough people know that part of your story and
that's not lost on us at all.
And Daniel's story too. I think we should have a Daniel room at Kadelyx.
Yeah, next to my Ojibwe room.
Yeah, maybe we could rename some of those rooms. It might be time.
Yeah. So,
you have to leave the Chippewa room.
So did you have the opportunity to heal with ketamine?
Somewhat, yeah. I was part of the equation. Yeah, no, I've used ketamine before in the therapeutic context. Absolutely, yeah. And it's as advertised.
Yeah.
Plain and simple. It works. Does great things. And yeah, it might make you feel like you're having an out-of-body experience. You might see things. You might hear things. You might feel things.
Yeah.
I tell people it's important not to have too many expectations about what happens because, you don't know. And I think like something that's so important too when people do ketamine, it's to use it with intention.
Yes.
And that's our slogan, by the way, or our tagline, I guess, is journey with intention.
Journey with intention.
Because that's what it's all about. Like approach the experience with some degree of intentionality. And I tell people it's great to have that intention. Like I love that you want to get to that endpoint, but don't think you're going to know how you're going to get there.
Yeah.
Like you don't know where that road's going to go along the way. Like
that meandering river. Simply be open to it.
We always like to say, like, for life and in healing, just loosely held intentions.
Yeah, very loosely
you have your
intentions,
but like just being open to what comes. And I do think there's something really powerful where, as the healer, and I use this as well. You have your own human experiences, and you're helping, taking those to shape the healing that you're offering to other people. And I think there's something very reassuring especially when you're going into non-ordinary states of consciousness. I will tell you that the majority of people that I work with that I'm giving ketamine to will ask me, they'll say, have you been where I'm going? Because they're nervous or, non-ordinary state of consciousness. What does that even mean? It's people find comfort.
What am I about to embark upon?
Yeah.
Have you experienced that yourself?
Everybody asks.
Right.
Yeah.
Everybody asks. And rightfully so. I mean,
Heck yeah.
just part of the experience
Yeah.
to be able to talk. And that was, like, truthfully, that's part of my motivation of trying to use ketamine, is not just for myself, frankly, but also to be able to communicate that to patients. I think that I think more doctors probably should be open to those kinds of experiences, frankly, on behalf of their patients. Yeah, and definitely, like, a lot of the experiences I've had medically or otherwise have been very informative about how I ultimately treat patients. Like, I had sciatica, I had back surgery before. I go through this really long thing with my patients who have sciatica in the ED. Very long. I teach them PT exercise. I do go through this whole thing. Yeah, I mean, how can it not? And if it that doesn't affect you, if that doesn't change your practice, really makes you wonder, like, what's going on there? Like,
Why do you
need
do
to
what you
absorb
do
those
then?
lessons. Yeah.
Well, I believe that part of the disconnection in medicine is because, and maybe this is starting to change in the training. I don't know, but I was trained before you, but not that long before you, and I think people confuse appropriate boundaries with losing part of that human connection, right? Like, so obviously this is about taking care of the patient. I'm not going to overlay my personal experiences. I'm here to serve the patient. But at the same time, I'm telling you, a little bit of understanding and having this person that's sitting with you know that you're human makes such a big difference in their receptivity, how they respect you, and also how they're able to, facilitate trust, So I'm grateful that you're able to share that part of yourself with people.
Yeah, Dr. Joe Tafur told me that one time explicitly too, about, like, he told me people are searching for humanity in their healers. That was very profound. He said that, I just, really resonated with me. People just want to know you're a human. So yeah, we try to, and that's kind of like how we do our guiding. We try to create some general recommendations and, of how to guide appropriately. But at the same time, we want the guides to show people that they're a human, and that, yes, they've had experiences that can inform this therapeutic alliance, and that it can be beneficial to both sides, and that's okay. Yeah, that's a good thing. That's a good thing. Yeah, it's too mechanized otherwise.
On that note, that's a beautiful ending, I think, for today. This conversation with you two physicians has been very expansive. I've learned so much from both of you, so thank you for all that you do and that you continue to share with our community.
Thank you, and I'm excited, to be working with you and Kadelyx and bringing that psychiatric lens to the table too. And I think you and I live what we're talking about so nicely, right? Where we really want everyone at the table, because we're all needed. Yeah.
Medicine is best done as a team sport. Trust me. I think it just bring everybody together. Why not? And that's, I'm all for it. No, I'm really grateful to work with you, and I'm really grateful for both your perspectives. It's been really fun. So thanks so much for having me.
So great.
All right, and we'll link up the
Kadelyx
to the show, and
sounds good.
Let the healing begin.
Love it.
Continue, I should say.
Awesome. Thanks so much.
Thanks. The content of this podcast is for informational and educational purposes only and does not constitute medical advice. The use of psychedelics, including those discussed in this podcast, may be illegal in certain jurisdictions, and we do not advocate or condone illegal activities. Always consult with a qualified healthcare professional before making any decisions regarding your health, mental well-being, or the use of substances. Psychedelics can have profound effects, and it is essential to approach them with caution, awareness of the law, and under the guidance of licensed professionals where applicable. Use of any substances should be in accordance with local laws and regulations. We care about your well-being here at recoverHER.